score and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212-CHOICES, 212-CHOICES for a fresh second opinion and a free booklet DVD. Conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment, call 212-CHOICES, 212-CHOICES. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery, New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back, and we're taking your calls. New information about young survivors of skin cancers. Non-melanoma skin cancers are at an increased risk for other cancers later in life. There was a study published in Cancer Epidemiology, Biomarkers and Prevention, and researchers utilized information from the All England Record-Linked Hospital and Mortality Dataset, which was collected between 1999 and 2011. They analyzed 500,000 people who had been diagnosed with non-melanoma skin cancers and compared them to almost 9 million in a control group. Overall, the people who had been treated for non-melanoma skin cancer had an increased risk of other cancers later in life. What were the cancers? Can you imagine? They don't seem related to the skin. They involve the bladder, the brain, the breast, the colon, the liver, the lung, the pancreas, prostate, and stomach throughout the entire study period. And people who had been diagnosed with non-melanoma skin cancer before the age of 25 had the greatest risk. Young people were 53 times more likely to get bone cancer, 26 times more likely to get blood cancers, 20 times more likely to get brain cancers, and 14 times more likely to get any other form of non-skin cancer compared to the control group. And as the cancer survivors got older, the risk for developing other cancers decreased. So early detection of cancers through screening works, and then evaluating these patients. So sometimes there's associations which no one thinks much about, and that's why it may be best to see an oncologist, spend an hour, yes, giving an hour of your life or so, getting evaluated. Call us at 212-CHOICES, 212-CHOICES. And there's another study that looks at diabetes and cancer. Well, not surprisingly, the mortality rates for people who have cancer and diabetes are higher than those who do not have diabetes. The outcome appears to be worse for diabetes patients with cancer who were treated with insulin, which increased the mortality risk for both men and women. And this was a study from Denmark that was reported in Diabetologica. The findings were, quote, in accordance with the existing evidence that more extensive diabetes treatment reflects a larger degree of comorbidity at the time of cancer diagnosis. So, again, another reason to spend an hour, think about it, get the best possible advice in your situation. One phone call won't do it. A phone call is the start of a long, healthy, productive relationship. Our number's 212-CHOICES. And in a response published by Harold Freeman, who's a cancer surgeon, in the New York Times this week, responded to why black women with breast cancer are 40% more likely to die of their breast cancer than white women. And the main reason is access to treatment. So the bottom line is, if you have breast cancer, if you have a lump, come in and see us. Don't delay. delay is lethal. And he writes, the reasons for black and white differences in breast cancer outcomes are complex. Although the incidence of the disease is higher among white women, black women are more likely to die from it. Young black women tend to develop a particularly aggressive form. But for many years, the dominant cause of higher mortality has been late-stage disease at the time of initial treatment, in part of the result of black women being less likely to undergo mammography. But, he writes, this gap has been closed. The Centers for Disease Control report that the rate of mammography is now the same in black and white women. So what remains is what happens after the mammogram. Black women experience significant delays in diagnosis and treatment. According to the CDC, even when they have similar insurance coverage, 20% of black women with an abnormal mammogram wait more than 60 days for a diagnosis, compared to only 12% of white women. And 31% of black women wait 30 days to begin treatment, compared to 18% of white women. The Institute of Medicine reported in 2003 that black Americans with health insurance, similar to that of white Americans, are less likely to be recommended to physicians to receive curative cancer treatment. Heath says this is because people make assumptions about race that can be harmful. A specialist treating a poor black woman may doubt she will comply with complex treatment and recommend a simpler, non-curative therapy instead. That is sad. The good news is that studies show that black and white women who receive the same breast cancer treatment at the same stage of disease are equally likely to survive. Let's eliminate the barriers to early diagnosis and quality treatment to black women, and we can close the racial mortality gap. So isn't that why we're here today? We're here to reach out to you. Just call us, 212-CHOICES, 212-CHOICES. You can come in next week and get evaluation, get treatment if necessary, and get proper treatment. That's always necessary. So that's what the answer is, and he closes by saying, access to insurance does not assure access to quality health care, especially for the poor and less educated. No patient with cancer should go untreated or experience a delay in treatment that diminishes survival. People should not die from cancer because they are poor or black. This is more than a medical or scientific issue. This is a moral issue. So yes, Dr. Freeman, you're right. And to patients out there, black, white, green, yellow, blue, or otherwise, call us at 212-CHOICES and make a date to come in for a consultation. Spend an hour of your time at 212-CHOICES, Radiosurgery, New York. We have a call. Howard, we have a minute. It's the end of the hour, so what's up? Well, we missed your call. So, Howard, call me back at 212-CHOICES after the show. 212-CHOICES. We talked a lot about different cancers today. We have many, many cancers and topics to cover. Luckily, we have 4 more radio shows over the weekend. They're all different shows on WOR. You can start at 1:30 in the morning, tomorrow morning, 3 a.m. in the morning, a live show at 6 a.m., and 9 p.m., all one-hour shows. We have 4 more one-hour shows this weekend, and we'd love to hear your voice about topics. Just give us a call. And you don't have to talk to us on the radio. The best is talking to us in person by calling us at 212-CHOICES. We're a private cancer center. We take insurances, Medicare, Medicaid, so we're out to do things promptly, take care of you, give you the best possible care. So thank you for tuning in. I hope you have a healthy weekend, a healthy time, a great week, and God bless. Thank you.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
You know, when you're talking the big C, cancer, a lot of times people have gone through prior chemosurgery or radiation and it just didn't work or didn't get the desired effects. All of a sudden you want to get an opinion on what to do. Well, Dr. Gil Lederman treats not only newly diagnosed and recurrent cancers anywhere in the body, but definitely will specialize with those folks who already been through a process that didn't work, and now they're trying to reconfigure in terms of what they can do, and he goes one-on-one with you. In fact, he'll send you an informative booklet, DVD, and arrange a prompt meeting to discuss all choices at his convenient office located on 38th and Broadway in Manhattan. He's a brain and prostate cancer as well as body cancer expert, also treating breast, lung, pancreas, liver, kidney cancers, and more. And back in 1991, I referred my dad to Dr. Gil Lederman, and he came up with a solution for his medical problem. Harvard-trained radiation oncologist, first brought non-invasive stereotactic body radiosurgery to America. He has the longest experience treating cancer using radiosurgery with no cutting, bleeding, anesthesia, or hospitalization. So just call Dr. Gil Lederman for your cancer treatment choices at 212-CHOICES. Write that number down if you want to refer someone to call, or call Dr. Gil Lederman for that person at 212-CHOICES. That's 212-CHOICES.
This is where New York comes to talk. Legendary 77 WABC, New York. A Cumulus station. Cumulus station. Cumulus station. Cumulus station. Cumulus station. Cumulus station. Cumulus station.